Hi, I'm Ruanne Brell. I'm a Senior Legal Advisor at Avant. Today, joining me is Dr. Michael Wright, Avant's Chief Medical Officer.
Hi, Ruanne.
Medicare and the rules and requirements associated with it can be complex. In this series, we look at some of the top questions our members ask us about Medicare and what you need to know. In this episode, we're going to talk about how Medicare billing can work in a public hospital setting. So the first question, and one that we get asked often, is whether a practitioner in a public hospital can or should be billing Medicare.
Well, the starting point is that a public patient in a public hospital should be treated free of charge if the patient has a current Medicare card and the treatment's clinically necessary. So for most patients, when they're in the public hospital, they won't actually notice that they're being billed by Medicare, but Medicare will be picking up some of this fee through state hospital funding. But there are situations where patients can be admitted as private patients in public hospitals, and at those times, they may be asked to show their Medicare card and billed Medicare directly through that.
So essentially, it is okay for someone to use their provider number in a public hospital to bill Medicare.
Ruanne, yes, subject to some rules set out in the National Health Reform Agreement between the federal government and the states, where Medicare eligible patients can be treated by their chosen doctor privately, as long as that doctor has a provider number for the public hospital and a Medicare item can apply.
So, Michael, you mentioned some rules. Are you able to explain those to us as simply as possible?
And so there are some basic requirements, which include that the patient is eligible for Medicare services and that they've elected to be treated as a private patient. So the patient must give their informed financial consent, and their choice to be treated privately must be in writing. Patients must have a choice of doctor, and the doctors treating the patient as a private patient need to have private practice rights, as in the case with visiting medical officers or VMOs, and not be already being paid for the service that they're offering.
Can a patient be forced to be billed privately?
Not usually. So Australian residents are eligible to receive most health services and emergency treatment through the public hospital free of charge. And such an eligible patient who came into hospital through the emergency department must be treated free of charge. If a patient is later admitted, they should continue to be treated as a public patient unless and until they be elected to be treated as a private patient. And equally, by choosing to receive private services, the department points out that a patient should not be given preferential treatment, and patients such as many overseas nationals and compensable patients are not eligible to Medicare benefits, and so they would be billed privately.
Great. And so how should a doctor's provider number be used then in a public hospital?
Doctors need to ensure that your provider number is only used for services that you personally provide, whether or not another person provides external assistance to you in accordance with accepted medical practice. It's important to remember that you are personally responsible for all Medicare claims made using your provider number.
So, Michael, that makes me think of outpatient clinics. Can someone bill Medicare for services provided in an outpatient clinic?
In some circumstances, they can. So most patients will be referred to the public outpatient clinic and won't see a use of their Medicare card there. However, if a patient's referred to a named specialist in an outpatient department who's exercising a right of private practice, and the patient elects once again to be treated as a private patient, then a charge to Medicare can be made. You cannot render Medicare services if you are being paid by the hospital for the same service.
And what about in the outpatient clinic generally? Can a doctor's provider number be used for all patients for that clinic?
Look, that's not appropriate. You shouldn't use your provider number for all the patients in the outpatient clinic on a certain day if you don't see them. Professional attendance items can only be billed under the provider number of the practitioner who actually saw the patient, whether or not someone else provided some support service.
Thank you. And for those that are interested, there are some useful case studies on the department's resources to help explain some of these scenarios, which will be able to be accessed through Avant's Medicare resources on our website. So that ends our discussion of this particular topic. Remember to look out for other episodes in our series explaining the ins and outs of Medicare billing and compliance. Thanks so much, Michael.
Thanks, Ruanne.